Good to have you back, brother.
Thank you.
How you been?
Been good, Doc.
You know, it's been about 3 years since I last saw you, a little over 3 years.
Yeah. Every day to come back sick. Feel bad, for real.
It's all right. So what's been going on the past 3 years?
Nothing, just trying to help my sister out.
Okay.
Yeah.
Who's been taking care of your feet?
I went to a beauty salon.
Beauty salon?
I couldn't go to a doctor.
Why not?
Because I was in Georgia, my Medicaid wouldn't pay for it.
Wouldn't pay for it down there? Okay. How long you been back in D.C.?
About 3 months, 3-4 months.
Okay. It was good to see you back, man. Last time I saw you 3 years ago, you had a big wound on this foot right here.
Yeah, I just had it done about 3 weeks ago.
Okay, where?
Beauty salon up in Silver Spring.
Okay, well this is what you need to stop doing. You need to stop going to beauty salons for your foot care.
I only went once.
Well, once was too many.
Okay.
All right, so, because with your diabetes and everything and your history of amputations, beauty salon is the last place you need to go. Okay, but you know, you're back in town. I'm going to get you squared away, keep you squared away. You hear the difference? Okay, definitely have an issue here on this right side now. All right, my man, so I'm gonna have to, I just can't take a blade and cut through this because it's so big, it's so thick, and it's hard as a rock. So I'm gonna have to trim around it first.
Okay.
All right? But if it hurts too much, let me know. If it hurts at all, you let me know.
Okay.
All right, use this tissue nipper here. Loosen this thing out of here. How have you been walking on this thing, man?
I was just gonna ask that too. How you put your shoes on?
Really haven't been wearing those shoes, been in the house.
Oh, okay.
So since you've been back to D.C., am I the first doctor you've seen? That's when you said about 3-4 months, right? Okay, here we go. And you have a primary doctor appointment coming up?
Tomorrow.
So how have you been getting your medications? So you haven't been taking anything for your blood sugar?
No. I've been taking blood pressure. I had enough for my blood pressure.
What about your diabetes?
I really haven't been worrying about it. It's been normal.
How do you know that?
I've been taking a test.
What test have you been doing?
The poke test.
The what?
Where you poke yourself.
Oh, you finger sticks? What have the numbers been looking like?
163, 156.
That's still a little high.
Yeah, but it's not that high. It's not as, at first I was getting like 400 or 500.
Okay. And how long ago was that?
That was like about a couple of years ago.
Okay. So what have you been doing? Oh, sorry, go ahead.
You know, it stayed at that point for like years, 400 or 500. You know, all of a sudden, over the past 3-4 years, it just stayed at 156, 163.
Okay. The last time you took diabetes medication was when?
Over a year ago.
Oh, no. That needs to be fixed. You're going to need a whole lot of workup, man. So you have no idea what your A1C is then?
No.
Okay. Look at this bad boy here.
Just Callus.
Man, it's like a rock. You know? See that? Show it to him.
That's on the side of your foot.
Well, you know, when I first came to you, it was way worse than that.
Yeah.
dropping the phone.
Yeah, that's fine. Well, fortunately, there's no ulcer under here. A lot of times when we work on this, and you start nipping away at these big, hard calluses like this, in our diabetic patients, particularly our diabetic patients with a history of, like yours, you start finding things underneath the ulcer. I mean, underneath the callus. Ulcers primarily. See where it's dark around the rim? See that, Alexa? Ruptured blood vessels there. So it's on its way to becoming an ulcer.
Could have broken, yeah.
So we got it just in time, huh?
Yep. Shave it down here. You see that?
It just, yeah.
Well, it's a good thing you came in today, brother. So this is the same thing you have here on the outside of your heel. It's real hard in the middle. You want to nip at it a little bit first before I bring the blade. So what kind of shoes you been wearing for the past 3 years?
Tennis shoes.
Tennis shoes? You never got any pads or insoles or anything like that?
No.
Let me tell you something, man. To be dealing with this for 3 years, since the last time I saw you, you've been basically doing it on your own and going to nail salons. You are very lucky. I'm here to tell you. Nothing against nail salons, but that's not where you go for this. They didn't tell you to go to a doctor?
Yeah, she told me the last time I went. She said I need to go to a doctor. She said I had some type of pus or something in there.
And which one?
In the left leg. The one you just fixed.
Okay. The one that we fixed last time you were here?
The one you just fixed this morning.
Oh, this one right here?
Yeah.
Okay.
She said there was some pus coming out of it. And she couldn't really do it. I needed to go to a doctor.
And did you?
Yeah, I'm here now.
Oh, okay.
That was just recently.
Very good. Okay. Well, here we go. You able to run us down at the new spot? Look at this.
Yeah, he went down to the old location.
Okay. And so this is a high pressure area because of this amputation you've had of your big toe. Now you get a lot more body weight here. So yeah, you're gonna need custom shoes and insoles, man. Which means you need to make a mold of your feet, not just something off the shelf. To take the fill in the spaces where your toes have been amputated on both feet, and to help to evenly distribute the body weight across your feet, and to decrease the pressure on these areas. Because it's all at risk of developing ulcers.
Pressure points?
Yeah. He was asking about Sade a little while ago.
Oh, yeah, she's good.
She's doing fine.
At that age.
All right, bud, let's move on to this other side. Let's go. In the past 3 years, you haven't had any more ulcers on your feet?
That you know of.
Yeah, that I know of.
Mm. You haven't had to go to the emergency room or anything? You had the foot angels looking after you, man.
It must have been. 3 years I haven't seen.
Without you? Because they've not seen any doctor of any type for 3 years with your history.
I figured it wasn't as bad as it was when I first came in to see you. You had like cured it the first time.
Yeah. We got it healed up.
Yeah, you had it healed up and everything. Took a while to come back, but it did.
Yeah. So that's the thing about neuropathy, is that a lot of times, you know, these patients can't feel anything or don't feel the amount of pain or discomfort that they normally would.
The normal patient would, right?
Yeah, so that no pain, no problem, right? So that's where you were. No pain, no problem. And actually, you had major issues going on. But again, you dodged quite a few bullets with all this that's happening. See, all this here, that's developed because of the imbalance in his foot after the amputation of his first, second, and fifth toes. Yeah, the foot is a very carefully balanced machine.
Yeah.
And when things go awry, whether it be from amputation or arthritis or bunion deformity, hammer toes, whatever, when things get out of balance,
It's your whole body.
yeah, it can affect other parts of the foot, the leg, knees, hips, lower back, you name it.
Right.
So dry skin here. So you got the center of the fifth metatarsal here, where the little toe used to be.
So that's where the weight points.
So you notice everywhere he's had an amputation,
Is the
he has a callus
Mm-hmm.
associated with that location. So what we're doing here, my man, shaving these down, reduce those pressure areas. You need to have this done about every 6 to 8 weeks.
6 to 8 weeks?
Yeah. Come up right up in here. I get you squared away. Along with the shoes and insoles. Help prevent the formation of new ulcers. And we're going to have you come in either a couple of days or next week to get your circulation test done. So I got this scrub brush, man. Work on this dry and loose skin you have here. It's got the foam on one side and the brush on the other.
Yeah, okay.
A little soap. You tickle? Sorry about that.
It's okay.
The brush is soft, so it won't irritate or injure the skin. Are you able to reach your feet okay?
No, I can't reach them at all.
You can't reach them at all? Why is that?
Can't bend.
What's stopping you from bending?
My knees.
Your knees? Okay. Who do you live with?
I live with my uncle. He just got his leg cut off.
Oh, shoot.
Yeah.
What was that all about?
He had a bad infection. Started getting gangrene in his leg.
Is he diabetic too?
No, he's not diabetic.
He's not diabetic?
Mm-mm.
You're going to need some daily skin care to these feet, man. Somebody's going to have to do it for you.
And my daughter been coming over helping me out a lot.
Okay. I want to prescribe a lotion for you.
Yeah.
All right?
I have to put it on.
It's called ammonium lactate. We prescribe it a lot for our diabetic patients.
Mm-hmm.
So I have to do that for you once a day. All right?
Right. Now I stopped smoking.
Excellent. How long ago?
In March.
March. Okay. So that's what, 5 months ago.
Mm-hmm.
So how did you do that?
Yeah. I had a high blood pressure attack.
Mm-hmm.
Couldn't breathe.
Okay.
For some reason I couldn't breathe, and it was causing to the smoking and high blood pressure. So I was like, well, that's it for that. Been smoking over 50 years.
Wow. And you just quit cold turkey?
Mm-hmm.
No
I was in
program?
the hospital at the time.
Okay.
For 6 days, so.
So no program, no gum, no patches, nothing like that?
Nothing.
Wow. So again, man, it's good to see you back. With everything that, yes, sir. With everything that we saw here today, you know, it's fortunate nothing worse has happened.
Mm-hmm.
But that doesn't mean we can, you know, sit on our laurels.
Yeah.
Because we got to be more proactive now.
Now that we know,
Mm-hmm.
definitely know for sure what needs to be done.
Sorry. So again, we take care of these calluses and things every couple of months.
Mm-hmm.
We've already put in the prescription for the shoes and insoles. You're going to be coming back for your circulation exam. All right?
Okay.
That way we stay on the front side of everything instead of trying to play catch up if something bad happens, you know?
Yeah.
All right, man. Now this is much better. All right. There we go, man. Looking good. How we feel?
Feel good. Just need a nurse to help me with my shoes.
Oh, no. We're going to get that taken care of for you. Excellent, man. Any questions?
No.
Okay.
I took care of everything.
Very good.
You fill out some prescriptions for me?
Oh, yeah. Get all squared away. All right, my man.
Okay.
We'll be seeing you soon.
All right. Thank you.
This is Kevin Jefferson, the DC Foot Doctor. Thank you for watching this video. Like it with a big thumbs up to see very interesting cases and my approach and techniques to dealing with them, and to learn how you can improve your foot health. Subscribe to the channel. Ring the bell so you will know when a new video has been uploaded. Follow me on social media at DC Foot Doctor. Most importantly, take care of your feet.